Professor Aniruddha is an associate professor in the Department of Gender, Women's and Sexuality Studies and Asian and Slavic Languages and Literatures at the University of Iowa. They're interested in the study of contemporary globalizing processes, the political economy of gender and sexuality, transnational discourses, and the practices of development. And of course, the institutionalization of gender and sexuality identity politics with specific reference to India and South Asia.
So I'm going to begin with two statements or two quotes from two community members that I've worked with, collaborated with intimately during the whole COVID crisis. First one is Moshumi Shaha, who is a guru or a senior leader of the trans-feminine Hijra community at Kalyani, West Bengal. That's my hometown and where I'm located right now. Who talks about the situation of trans people and people in general during the COVID-19 pandemic and the lockdown that the government instituted in response. She says, we became destitute. Why? Simply because the Jonogon or general public had no income, buses, trains were not running, people were not in a situation to be able to work. And then Silk, a trans activist from Kalyani, West Bengal, says that, points out how the government evaded its responsibility during this period. It provided relief to our community mainly to earn a good name for itself. And if 1,000 of us needed relief, it provided only to 300. Also, it did not give relief immediately, but only when we had already started raising our voices, when they heard that relief was coming in from abroad, that we were doing fundraising, right? So this is, of course, in the context, in a context where transgender and gender non-conforming communities and persons, particularly those from predominantly working class and Dalit or oppressed caste backgrounds, such as Hijras and Kothis, have been among those hit hardest by the COVID-19 pandemic in India. And journalists and scholars have documented a litany of negative impacts, including the loss of livelihood, psychosocial isolation, lack of access to healthcare and relief, and also even intensified social stigma due to fears of COVID-19 transmission from these communities. As Silk's aforementioned statement suggests, these impacts were not merely due to the pandemic itself, but they were also partly precipitated by the nature of the state's response to it. And this response was spectacularly exemplified by the lockdown declared on March 24th, 2020, right here. So this lockdown was actually declared with just a few hours of notice, as no doubt many of you know. And it was meant to contain the transmission of COVID-19, but ironically might have fostered its spread from urban to rural areas due to the exodus of migrant workers who lost their employment in cities. The early phases of the lockdown, as many media reports have noted, imposed an almost complete ban on industrial, commercial, religious, and cultural activity, except for some essential services, and also exerted severe restrictions on people's movements, which particularly affected the working poor adversely. Ironically, the timing of the lockdown was also really odd. The early phases of the lockdown were happening which was the strictest phases of the lockdown. They were happening when infection rates were quite low, and it was eased when infection rates were increasing. So while measures related to physical distancing were, of course, and remain essential to containing the pandemic, Indian public health activists have critiqued this extremely ill-planned, centralized, and top-down lockdown, which involved police violence and coercion, and also ended up treating unprivileged people like, as a statement says, criminals or subjects under colonial rule. The economist Jayati Ghosh argues that, quote, the nature of the government response destroyed the economy and forced millions into poverty and hunger, but did not control virus transmission, unquote. Further, as suggested by Silk's statement above, the lockdown's severity and ultimate inefficacy at containing the infection contrasted with the inadequacy of relief packages announced by the central and state governments, many of which merely repackaged or added to provisions that had already been contained in the annual budget announced before the pandemic. In this context, This paper will examine the role of the activism of trans communities and organizations in addressing the pandemic and also the lockdown, particularly focusing on the first wave of COVID-19 in India in 2020. As Silk's statement indicates, the debilitating effects of the lockdown and the inadequate or tokenistic relief provided by the government prompted a flurry of organizing and fundraising by trans and kothi-hijra, that is trans-feminine spectrum, activists and organizations. This burgeoning sphere of COVID-related activism addressed not just their own communities, but as scholars and journalists have noted, even reached out to other marginalized social groups and thus helped to mitigate the intensified structural isolation and marginalization of both trans and other vulnerable people or groups during this period. However, this process also highlights how, in Silk's words, quote, the government evaded its responsibility, unquote, which was instead transferred onto civil society and non-state entities. As Iona Datta and Padmini Ray Murray note based on their research in Bangalore, quote, in this absence of state, civil society stepped in to address the knock-on effects of subsistence rupture to the urban poor and their families, unquote. Since the immediate need for relief took precedence over challenging state policies, such mobilizations may be seen as accelerating the process of responsibilization, wherein the civil society and individuals take up responsibility to make up for the decline of state infrastructure and social security, which is a process that characterizes neoliberal capitalism, according to several scholars, including Burchell writing in 1996, Aradhana Sharma in 2008, and so on. However, as I shall argue, these mobilizations also evidence several ambiguities and contradictions rather than completely fitting into the narrative of responsibilization within neoliberalism, which only tends to tell a part of the story. The Indian state also utilized the pandemic period to institute or rebuild developmental mechanisms for trans welfare, such as transgender development boards and National Council for Transgender Persons, pardon me. So I will build on existing scholarship on Indian neoliberalism to argue that the relation between trans activism and the Indian state belies any universalizing conception of neoliberalism, and rather it suggests a patchy incorporation of some typical neoliberal policies such as deregulation, privatization, and the reduction of social safety nets, alongside continuing ideologies of the developmentalist and welfarist state. I argue that both independent trans initiatives that substitute for state welfare and also the incorporation of trans activism into the state's developmental mechanisms have reinforced profound inequalities among activists and communities based on class, caste, and geographic location, as shown in inequalities in access to private funding, as well as the prioritization of elite trans activists within undemocratically constituted state bodies for trans welfare. However, trans activism has also directly challenged or subtly counteracted both neoliberal and developmentalist modes of governance during the COVID-19 pandemic. The following sections explore these contradictory tendencies based on ethnography and collaborative activism in the Eastern Indian state of West Bengal. I particularly focus on a spectrum of feminine identified people who go by various names, including transgender, Kothi, and Hijra, communities within which I'm often included as a member and with whom I've conducted more than 50 months of ethnographic fieldwork spread over 14 years. Kothi is a term used by a spectrum of gender variant people, including those who describe themselves as feminine males, as women, as a third or separate gender, or people who have fluid subject positions. Hijra communities similarly comprise a range of subject positions, but are more typically associated with formalized kinship systems organized around Guru Chela or leader-disciple hierarchies, and also with certain typical professions such as blessing people for money during auspicious occasions like childbirth, or in everyday contexts in public spaces like streets and trains, due to their declining cultural association with the auspicious power to bestow people with fertility. Some Kothis and Hijras also do sex work, which generally occupies a lower rung among community professions. There is also considerable overlap between these communities, and Kothis may join Hijra kinship systems and professions, either temporarily or permanently, as I've explored in my earlier work. My long-term involvement and partial inclusion within these communities also allowed me a particularly close look at how they negotiated with the COVID crisis, and are still doing so actually during the second phase of the pandemic, and also enabled me to collaborate with them in some COVID-related activist and fundraising initiatives. In the first section of this paper, I built upon this work of scholars like such as Aradhana Sharma, Srila Roy, and Stephen Legg, who have theorized the Indian state as being both neoliberal and developmentalist, to argue that governance during COVID has functioned as an unstable assemblage or conjuncture of neoliberal and developmentalist policies and strategies in keeping with long-term systemic patterns, rather than marking a temporary departure from neoliberalism, as some commentators and critics have suggested. The second section draws upon the aforementioned ethnographic observations and fieldworks, and also interviews, to specifically situate trans communities and activism within this neoliberal developmentalist assemblage, and to explore, and it further explores the resultant contradictions negotiated by these groups and activists. I conclude by suggesting some structural limitations and potentials of trans activism in context of the COVID-19 crisis and beyond. So the first section, situating India's COVID governance as a neoliberal developmentalist assemblage. The Indian state's heavily interventionist response to COVID-19, citing the collective end of public health, combined with inadequate welfare provision, requires some contextualization of India's position vis-a-vis the concept or term neoliberalism. As a term describing transformations in the relation between states and markets since the late 20th century, neoliberalism has been debated and critiqued as an imprecise, multivalent concept that may be vaguely totalizing in being mutably used across vastly different geopolitical contexts. Definitions commonly tend to stress that neoliberalism involves deregulation of capital, privatization, and the reduction of the state's role in development and welfare. As Kiasha Naidu states, neoliberalism, quote, promotes individualism and the belief that unregulated free markets yield efficiency and prosperity. The state is expected to act minimally to secure the conditions necessary for the market, unquote. However, as scholars like Aradhana Sharma and Aiwa Wong have argued, despite transnational tendencies of market liberalization over the last 3 decades, relationships between the state, market, and society are articulated in very uneven ways across the global south, and variations in the nature and extent of state interventions trouble neoliberalism's supposed global reach and uniformity. Commentators on COVID-19 point out how the pandemic has exposed the paradoxes and limitations of neoliberal economic logics that prompt the state to depart from its expected role. Neoliberalism is typically associated with the propagation of individual liberties, entrepreneurship, and responsibilities over the collective or social good, and with the retreat of the state from its role as a provider of social services to the role of a financier and regulator of so-called free markets. However, as Naidu notes, the COVID-19 pandemic compelled governments across the world to take strong decisions in collective solidarity. Pooja Mehra writes how the pandemic caused states to not only amp up welfarist measures, but even flirt with socialist policies such as the temporary nationalization of businesses and wages to ensure basic income in countries like France. In India too, Mehra notes that, quote, the Narendra Modi government will foot the bill for the Employees Provident Fund or EPF contributions for 8 million organized sector workers earning up to 15,000 rupees a month in private companies, although the package leaves out millions of informal workers in the unorganized sector, unquote. Miloš Shumonia writes that these measures are akin to a form of emergency Keynesianism, marking a temporary resort to social provisioning rather than a long-term departure from neoliberalism as such. While the idea of the pandemic as prompting temporary exceptions from long-term neoliberal trends might be valid in certain contexts, it might inadvertently totalize the idea of neoliberalism as the default phase of capitalism from which countries are now compelled to deviate due to the pandemic. As scholars as Aradhana Sharma, Srila Roy, Stephen Legg, and Pallavi Raunka have argued, a generalizing concept of neoliberalism cannot capture the complex and ambiguous negotiation between developmentalism, state welfare, and select neoliberal principles that has long characterized post-colonial and even post-liberalization India from long before the pandemic. Drawing on this work by people like Sharma, Roy, and Legg, uh, excuse me. So one can state that even after the liberalization of the Indian economy in the late 1980s and early 90s, the Indian state has continued to be both developmentalist and neoliberalizing. Under pressure from international financial institutions like the IMF or the International Monetary Fund, successive Indian governments have profoundly and yet selectively adopted certain policies typically associated with neoliberalism while deviating from other elements. Conformity with neoliberal principles is clearly evident in cases like the deregulation of markets to enable greater foreign direct investment, the privatization of sectors like banking and aviation, and the reduction of agricultural subsidies. However, the Indian state evidences a more fluctuating treatment of welfare as well as socioeconomic individualism. Aradhana Sharma notes that the numerical increase in quasi-state and non-state actors, such as NGOs in post-liberalization India, sometimes aided by the government itself, that even sponsors some NGOs, but gradually shifts the direct responsibility and burden of poverty relief and grassroots development to these non-state entities. This might seem to affect the gradual responsibilization of non-state bodies for social services. However, as she states, quote, the contemporary Indian state cannot fully relinquish its development and welfare functions because its legitimacy rests on precisely such functions. The developmentalist imperatives of the state have meant that the Indian government continues to run and has even expanded some large-scale welfare-based programs, unquote. The state's wavering stance towards welfare becomes clear with respect to India's public distribution system, or PDS, which delivers subsidized food grains to over 2/3 of the population and which was a crucial part of COVID relief measures announced by the government during the pandemic. Post the liberalizing economic reforms of the 1990s, the Indian federal government or central government seemingly followed a typical neoliberal path in trimming the PDS from universal to targeted coverage aimed at poorer demographic sections who had to show BPL or below poverty line cards to qualify for subsidized prices, which led to the exclusion of large numbers of working class and Dalit people from the system, given errors in documentation and also due to the low poverty line as mandated by the government. However, in the 2010s, several state governments, particularly Chhattisgarh, moved back to a less targeted and almost universal PDS following electoral pressures and push from social movements like the Right to Food campaign, which eventually led the central government to adopt the 2013 National Food Security Act, or NFSA, which propelled the PDS system back towards a broader coverage. After the current Hindu right-wing and corporate-friendly NDA government took over from the previous UPA regime, there were indications that the PDS system might be replaced with a targeted direct benefit transfer, or DBT system, which would require beneficiaries to open bank accounts and obtain biometric Aadhaar cards, which again would potentially exclude many poor people with uneven access to such technologies and documents. However, the in-kind distribution of food grains through the PDS has remained, and in fact was expanded and made free in many states during the COVID crisis. The Modi government also threatened to dismantle the Rural Employment Guarantee Act instituted by the previous government, which guarantees employment to the rural poor for a fixed period per year. But as Amrita Chachi notes, in the end, it rebranded the act as a gift from Prime Minister Modi, who postured as a benevolent patriarch. This demonstrates how the idea of the state and politicians providing welfare has remained ideologically important, and how Indian state policy has repeatedly touted welfarist claims contra typical neoliberal ideology, while also reducing public expenditure in some sectors in neoliberal fashion. This coexistence of developmentalist and neoliberal tendencies might work in both tense and conciliatory ways. On one hand, developmentalist tendencies may work to counteract or temper effects of neoliberal principles. Pallavi Raunka notes that the exigencies of electoral democracy and people's movements compel the post-liberalization Indian state to, quote, temper the excesses of neoliberal claims by maintaining and extending welfare programs, allowing the growth of corporate capitalism while mitigating the ill effects of primitive accumulation with anti-poverty programs, unquote. But on the other hand, developmental and welfare initiatives might also work in tandem with or even extend certain neoliberal policy agendas. Sharma notes how government-sponsored rural women empowerment programs reconfigured the state's commitment to national development through its ability to empower marginalized subjects to care for themselves and to participate in the project of self-rule, unquote, thus ultimately serving the end of individualized responsibilization. Amrita Chachi similarly notes that the current government has redesigned welfare mechanisms to draw in unprivileged populations into webs of finance capitalism and credit by mandating beneficiaries to apply for the so-called jam trinity of bank accounts, biometric identification or Aadhaar cards, and mobile phones, which increasingly brings the rural poor into the ambit of private and public banks and related financial schemes. Relatedly, the state has also linked some government schemes with the provision of credit meant to encourage individual entrepreneurship, especially for women and Dalit people. These cases suggest how developmentalist and neoliberal tendencies can work in tandem to extend state surveillance of recipient populations through biometric identification and digitized records. However, the typically neoliberal push towards economic individualism and entrepreneurship is accompanied by a contentious relation with individual liberties and freedoms associated with late capitalism, as is also true of right-wing governments and forces in the West. As scholars like Ashwini Tambe note, exclusionary forms of Hindu collective belonging and solidarity and related social moralities have been encouraged, leading to the curtailment of individual and group rights for religious and gender sexual minorities. Overall, thus, these various strains of scholarship suggest that the Indian case is perhaps better understood as an assemblage or unstable conjuncture of several contingent tendencies rather than through any overarching concept of neoliberalism. The Indian state's governance during the first wave of the COVID-19 crisis, sorry, I think I need to go back. Yeah, sorry. The Indian state's government during the first wave of the COVID-19 crisis might be seen as an evolving moment of the long-term assemblage of neoliberal, developmentalist, and welfarist policies in India. Critics of neoliberalism have noted that the lack of adequate state expenditure on healthcare and policy excuse me, can I be heard? Okay, I'm continuing. So critics of neoliberalism note that the lack of adequate state expenditure on healthcare and policies promoting privatization of an individual responsibility for healthcare prompted or precipitated the COVID-19 crisis across many countries, including India. Yet during the crisis itself, contra the elements of neoliberal ideology that valorize a minimized state, the governments took on a strong interventionist role in enforcing lockdowns and collective behaviors for the putative social good. As the public health activist network Jan Swasth Abhiyan points out, the Indian state's lockdown generalized containment strategies that were not well suited to the Indian context and ultimately did not promote safer behaviors. Kitchen, Dutta, and Murray suggest that the reliance on disease control through lockdown and digitized surveillance mechanisms while neglecting the multidimensional issues faced by the poor during this period suggests an approach of technological solutionism towards COVID. While some technological aspects of pandemic control may be new, the top-down application of abstract professional knowledge and technology without adequate local input or regard for context is a hallmark of pre-neoliberal developmentalist policy, as noted by development scholars such as Arturo Escobar. Further, the import of abstracted containment models from other nations such as China invokes the idea of modular development, which, as Sharma notes, quote, entails building models of programs that have succeeded in a particular third world location and transferring these models to other third world settings, unquote, often through a web of elite professionals and expert knowledge, such as healthcare experts. While the lockdown was typically developmentalist in these ways, it also demonstrated some key neoliberal elements. As the aforementioned Jan Swasth Abhiyan statement also points out, the Indian state enforced the lockdown as its main strategy while not adequately backing it up with other expert recommendations such as investment in healthcare, large-scale COVID testing, or resource provision for lockdown-affected people, especially in the early and most harsh phase of the lockdown. Thus, in effect, the government evaded or minimized its responsibility for healthcare provision, but also unleashed state power to enforce individual and collective responsibility for ending the pandemic, particularly on oppressed caste and working class people who were the ones being punished most brutally for violating lockdown measures. This reinforces neoliberal responsibilization, which as per Wakefield and Fleming renders, quote, subjects as individually responsible for a task which previously would have been the duty of another, usually a state agency, unquote. Mohan Dutta refers to COVID management in Singapore as a form of authoritarian neoliberalism, and this description might also apply to India, though mediated distinctively by India's unique developmentalist legacies. Neoliberal tendencies were also evident in the developmental and welfare measures meant as pandemic relief. While the state touted its welfarist role and image during the crisis by announcing a slew of relief packages, including the provision of free food grains to the poor through the public distribution system or PDS for over 6 months, commentators have noted how more than half of these measures were only repackaged versions of support that had been already included in the pre-pandemic 2020 budget. This suggests that such relief measures were a temporary, insincere effort at
Aniruddha,
crisis.
sorry to interrupt you. Aniruddha, you're probably going to have to repeat yourself over there because I think your connection went out for a little bit.
Okay, I'm sorry about that. There's actually a storm brewing here outside, so I hope this doesn't affect the connection more. So I'm just repeating from where this paragraph started. Neoliberal tendencies were also evident in the developmental and welfare measures meant as pandemic relief, while the state touted its welfarist role and image during the crisis by announcing a slew of relief packages, including the provision of free food grains to the poor through the public distribution system for over 6 months. Commentators noted how more than half of these measures were only repackaged versions of support that had already been included in the pre-pandemic 2020 budget. This suggests that such relief measures were a temporary and insincere effort at crisis management. Moreover, there were significant exclusions in the delivery of services and benefits, for instance, due to the use of outdated census data in selecting PDS recipients. Reports note that for several direct cash transfer schemes, the state required recipients to hold bank accounts and biometric ID cards, which excluded significant sections of the rural poor, and also in our context, specifically the trans-kothi-hijra communities from these packages, since many community members do not have updated documents or bank accounts. The routing of welfare through biometric cards and bank accounts also continued the process of extending digitized surveillance through welfare. Apart from parsimonious and exclusionary pandemic welfare, the leftist activist Harshvardhan also critiques how the state used the pandemic period to roll back environmental regulations on businesses and to relax labor laws, especially in states ruled by the governing right-wing BJP. The state is thus rolled back in the case of relief provision, labor law enforcement, and corporate regulation, but strengthened and enhanced in the case of surveillance and regulation of especially poor people, for example, through the control of movement. This combines the worst of neoliberal responsibilization with developmentalism and welfarist posturing. So now coming to trans activism in the neoliberal developmentalist assemblage. Trans activism in India during COVID-19 fitted into the responsibilization process by filling in for the aforementioned lack of adequate state support, but also it's linked up with the state's developmentalist mechanisms through which sporadic welfare was provided through these communities. To these communities. Reports note that the general direct cash transfer relief packages announced by the central government were inaccessible to a lot of trans-kothi-hijra people due to their lack of required documents. Also, while some essential food grains were provided freely to eligible recipients through the PDS or public distribution system for several months through a combination of central and state government allocations, the activist Silk from Kalyani told me that many trans-kothi-hijra people didn't have access to ration cards or had left them at home under male names. In this scenario, many trans activists advocated for specifically targeted schemes from both central and state governments. The state response was two-sided. There was a one-time direct cash transfer package of rupees 1,500 or less than $50 per head for transgender applicants by the central government's National Institute for Social Defense, or NISD, housed under its Ministry for Social Justice and Empowerment, which was announced in late March 2020 and disbursed in mid-April. Individual state governments also announced relief measures. For instance, the West Bengal government provided 2 relief packages comprising the distribution of food essentials to trans people in the state, once in late April and once in late April and early May 2020, and once over September and October 2020 during the annual religious festival of Durga Puja. These packages thus provided sporadic and not regular support. There were also many layers of exclusion and hierarchization, in the ways these welfare schemes were designed. Only about 4,500 people, or less than 1% of trans persons counted in the census data from 2011, received the central government's minuscule NISD grant of 1,500 rupees, as per a Times of India report from April 21, even though a government official in another media report claimed that 6,000 beneficiaries had been reached, but still remains a very low amount. Applicants were required to fill out online Google Forms in English or Hindi, which reinforced linguistic hierarchies of so-called global and national languages over regional South Asian languages, despite their recognition in the Indian Constitution on equal terms. And this meant that those not well-versed in these languages or lacking internet access had to rely on more formally educated and internet-enabled activist intermediaries to fill out these forms, thus reinforcing hierarchies of class and caste, given that such access is more typically available to middle-class caste and upwardly mobile community members. In the district of Murshidabad in mid-Bengal, a trans and Kothi identified community member told me that no one in the entire district of more than, I think, 3 million people, no one received the grant because such an intermediary was not available easily. In Coach Bihar district of North Bengal, Shumi Dash, a trans activist, told me that, quote, I filled the NISD form for 60 to 70 people, but 30 to 40 people got it. Not everyone did, unquote. There was no explanation from the government why about half of these applicants were denied. In keeping with tendencies of digital surveillance and welfare, applicants also had to supply their Aadhaar card and bank account details. And although there was a version of the form for those without Aadhaar and bank accounts, many community activists like Hena at Nodia told me that they did not know about this form, or they did not receive the link to this other form. The labor that activists had to perform in filling forms was also obviously uncompensated. And so this outsourcing of government work to the unpaid labor of activists suggests how neoliberal responsibilization strategies are incorporated into developmentalist and welfarist schemes. The intensification of class and caste hierarchies through a combination of developmentalist and neoliberal strategies becomes even clearer in the case of the state government relief packages provided in West Bengal. The first round of relief distribution over end April and early May was mediated via the West Bengal Transgender Development Board, housed under the state government's Ministry of Women and Child Development and Social Welfare. This transgender board was formed through exclusive and restricted consultations with large city-based NGOs in 2015, and then reconstituted without any consultation at all in 2020 during the pandemic period. In both cases, mostly metropolitan and or relatively elite activists were selected for the board and were selected to represent the community, represent these communities as a whole at the state level. Several community members and activists told me confidentially that they suspected that board members had been chosen on the basis of their prior closeness and contact with the government. Activists have also critiqued how, at the national level, bodies like the National Council for Transgender Persons have also been formed undemocratically during the pandemic crisis period. And often this council tends to favor upper caste middle class activists as members, most prominently, of course, Lakshmi Narayan Tripathi, and those known to be associated with such activists. Similar to the aforementioned linguistic hierarchies between English and Hindi as so-called global or national languages and the so-called regional languages, the constitution of developmental mechanisms that interpolate relatively elite trans subjects as members also reinforces multi-layered hierarchies of scale between national, regional, and local levels of discourse. Relatively elite trans queer activists from metropolitan locations get to represent the national and the regional and occupy positions of greater proximity to the central and state governments, whether intentionally or not. Meanwhile, activists with less fluency in English and Hindi and working in small town or rural areas, who also tend to be more often working class and Dalit Bahujan, are relegated to the so-called local level and to lower tiers of institutional power and lower ranks of the whole developmental mechanism. This hierarchization became clear in mid-April when the West Bengal Transgender Development Board urged, quote, all CBOs and NGOs who are working on TG welfare in the state to partner in this COVID response and come forward as nodal organizations at your area who will lead this distribution, unquote. CBO activists from districts volunteered to draw up lists of names of needy community members and to take the rations directly to them, often at personal risk, since the state did not provide them with any PPE. Thus, CBOs and activists working in non-metro and rural areas are called in for channelizing COVID relief at the district or local level, but are mostly not included in both the process of state-level board formation and also COVID-related program design. This combines neoliberal responsibilization through the outsourcing of the state's functions to unpaid trans-kothi-hijra laborers or workers, with the hierarchies of scale reinforced through top-down and non-consultative forms of developmentalism. Another potential source of surveillance and exclusion, but also activist challenge to such processes, is evidenced in the central and state government's reliance on the transgender category to demarcate and qualify gender non-conforming persons for COVID relief. As I mentioned earlier, the spectrum of Kothi-Dhurani-Hijra communities in Eastern India encompass a variety of gendered positions, including feminine males, binary trans women, third gender people, and various fluid combinations of these subject positions. While South Asian communities have adopted and hybridized transgender for purposes such as gaining transnational funds and building solidarity networks, the state's definitions of transgender tend to presume a binary between cisgender and trans categories, for instance, by separating Kothis as feminine males who have sex with males from Hijras as transgender, thus overruling this overlapping spectrum of such communities. As is well documented, the state has also often policed inclusion in the transgender category through psychological and even anatomical criteria, despite much activist opposition and protest. In context of the NISD grant, there was much ambiguity and confusion in activist circles regarding whether transgender identity proof would be needed for the grant. The form asked for Aadhaar card numbers, which are actually linked with gender categories. And both Shumi in Coach Bihar and Hina in Nodia noted that many community members have obtained their Aadhaar numbers under the male category rather than the transgender category. So they were, of course, anxious whether they would get this relief. However, in the form also asked if the applicant was associated with any transgender community organization. Some applicants in Coach Bihar and Nodia districts received the grant despite not having transgender Aadhaar identification cards, given that activists filled out their forms as being associated with their respective community organizations. In the case of the distribution of the state government's relief packages, the so-called local activists were the people actually disbursing the relief, and they used this position to exert agency in choosing a wider range of recipients than might have been included in the state's definitions of trans. Several activists, including Shumi at Coach Bihar district, Oruna in Murshidabad, and Silk in Nodia, told me that they extended relief to community members who might not qualify as transgender by state criteria. For example, Kothi community members who mostly wear male attire and might even be heterosexually married or have features perceived as masculine, such as beards. Thus, community activists and organizations serve to counter and or soften the state's gatekeeping of transgender. This shows how activists are not merely passive responsibilized agents, but might use their role to evade state surveillance exerted through trans-related developmental processes. As Aradhana Sharma notes, responsibilization is often seen as a shift of governance into the society from the state, but these negotiations and ruptures demonstrate how responsibilized agents may exceed or subvert their proper stipulated roles to challenge both neoliberal and developmentalist modes of governance. Outside of these activities that the trans activists conducted under the aegis of the state, there was also much independent trans-kothi-hijra mobilization, relief distribution, fundraising, and advocacy, given the inadequacy and sporadicity of state aid. Some of this work directly challenged the neoliberal responsibilization framework and sought to hold the state accountable to its developmentalist and welfarist promises, such as a petition signed by more than 2,000 trans activists across various Indian states that strongly urged the central government to provide more relief and critiqued the inadequacy of the NISD grant. However, since such appeals seemed to fall on deaf ears, in many cases, activists had no option but to step in and to fulfill responsibilities towards affected communities that the state did not fulfill. However, rather than a simple case of responsibilization, even this activism both reinforced and sometimes ruptured or challenged the neoliberal developmentalist assemblage of COVID governance. In the Coach Bihar and Nodia districts, for example, the community organizations of Moitri Songjog, Coach Bihar, and Nodia Sampriti Society provided support on a more continuous basis and often also reached out to more community people than those covered by the government schemes. As the activist Shumi Das from Coach Bihar told me, quote, the rations from the state government reached about 120 and 60 people over 2 times. On the other hand, we reached out about 15 times, and we covered about 400 to 500 people across the two districts of Alipurduar and Coach Bihar. We also provided cash support of rupees 1,000 rupees per head to 80 people and ran a community kitchen for 4 days per week for 4 months between June and September, feeding 30 to 45 people regularly. Unquote. Similarly, Sampriti and the activist Silk in Nodia also ran a 6-month-long community kitchen for 25 of the most vulnerable Hijra and Kothi community members in the area who had lost their livelihood of blessing people for money in public transport, and provided relief 3 times to about 150 to 200 people, more often than the state did. As Shuvi noted, their fundraising initiatives allowed them to build contacts with people inside and outside the country. This mobilization of support networks allowed both Shumi and Silk to explicitly critique metropolitan activists who dominated development mechanisms like the Transgender Board in public fora. Silk noted that this mobilization of non-state support also permitted her to refuse patronizing offers of relief from local political representatives, which she suspected were extending only to earn credit in the face of the West Bengal Assembly elections. Sharma has noted that state development programs in India have often reinforced gendered paternalistic hierarchies of benevolence welfare towards women. In this case, Silk used her responsibilized position to resist paternalistic welfare towards the feminized trans-kothi-hijra communities, while remaining critical of the state's dereliction of its responsibilities, as evidenced in her opening statement. Of course, such responsibilized activism also comes with its dangers. Just like access to inclusion within the state's developmental mechanisms, access to private funding was and remains striated and hierarchized in terms of the class caste status and national or transnational reach of activists. For instance, relatively elite and transnationally well-known Hijra activists like Lakshmi Narayan Tripathi, who is also known to be close to the Hindu right-wing government, was able to mobilize celebrity Bollywood endorsement by Vidya Balan for her fundraiser, while people like Silk and Shumi had to rely on social media and word-of-mouth publicity. This prompted individualist competition and jealousy among activists over and above collective solidarity, as per the tendency of individualism and economic competition associated with neoliberalism. Some sections of the Hijra community, particularly the Badhaiwali Hijras, who perform there during auspicious occasions like childbirth for money, also tend to be better off economically than their Kothi or Hijra counterparts who ask for money in streets or trains, and also those who do sex work. Therefore, such Badhai Hijras like Moshumi Shaha and Kalyani were able to draw on their savings to do welfare work for other poor people beyond trans communities, and some such Hijras even gained media and scholarly attention and praise for doing so. Meanwhile, Kothi and trans identified activists like Shumi and Silk, who had less access to savings had to reach out for aid for their communities, were sometimes accused of careerism and self-promotion through their fundraisers. Sometimes, ironically, these accusations came from metropolitan activists with much greater skills in English proposal writing and thus greater access to transnational funds. But these critiques often miss that such self-promotion is part of a limitation imposed by the hegemonic framework of trans representation in the media and public sphere, which prioritizes rural, working class, and Dalit Bahujan activists who can be framed as the exceptionalist achiever or pioneer, for example, the first transgender judge, the first transgender college graduate, and so on and so forth. Thus, neoliberal and capitalist individualism restricts how poor Dalit Bahujan trans people can access representation, even as activists use their representative positions to build welfare and relief for collective ends. Given these contradictory tendencies and conundrums evident in trans activism, it is hard to provide a definitive conclusion to my observations today. However, I hope I have been able to demonstrate the potential of utilizing tensions and gaps in the neoliberal developmentalist assemblage of COVID governance to both push the state towards fulfilling its developmentalist promises and responsibilities on one hand, and to push away from statist surveillance and paternalist welfare hierarchies on the other. Thank you.